Hi, I'm Dr. Tanya Ghosh. I'm an ophthalmologist, an eye surgeon who has specialized in treating diseases of the retina. I'm a retinal specialist. You were likely sent to me for further evaluation because perhaps you saw flashes of light or an arc of light in your eye, or maybe you saw some floaters or some strings or cobwebs or something else visually interesting or troubling interfering with your vision. I'd like to explain the most common cause of these visual issues, how they are likely not very dangerous, but how you made the very good decision to come in to have it checked out today. Let's start by introducing you to some basic anatomy. This is the front of the eye called the cornea. The area that gives us our eye color is called the iris. Now I'm pointing to the lens of the eye. This is the area that helps focus objects. This lens starts off clear when we are born, but gets cloudy with time. We call clouding of the lens a cataract. Cataract surgery is essentially a lens replacement where we remove the lens and insert an artificial lens in its place. Here in this space lives the gooey substance called vitreous humor. The inside back of the eye is coated by a tissue called the retina. The retina receives the light signals and sends it to the brain via the optic nerve. The retina has many blood vessels, as you can see here. The center of the retina has a name, and it's called the macula. The macula is very important to us humans. The macula is what gives us our ability to see fine details such as reading and seeing the fine distinguishing features of one's face. You must have fine vision to distinguish between letters such as P and B, and also recognize each different number. Animals such as deer have excellent side or peripheral vision. We human beings, however, hold our central vision in high regard. The vitreous gel is separated from the retina by a thin membrane called the posterior hyaloid. Now, at some point in our lives, perhaps in our 20s or 30s, some of us can start seeing some of these floaters in our vision. They are essentially clumps of proteins that may come off the membrane and then float about in the vitreous humor or vitreous jelly. These are not dangerous at all, but can certainly be entertaining or annoying. Don't worry, as they won't take over your vision. Thankfully, they are not signs of anything dangerous. A second, more common phenomenon can occur that can also be visually disturbing. This is the liquefaction or melting of the vitreous jelly. This is an absolutely normal and expected process of the maturing eye, kind of like the graying of hair. As we get older, as we mature, this vitreous jelly starts to liquefy or melt over many years. In the final month of this liquefaction process, the posterior hyaloid membrane lurches forward as it separates from the retina, and this could be a part of the floater that you see. The traction of the membrane separating from the retina can give the lightning flashes or the peripheral arcs of light. In the vast majority of people, there are no symptoms as the process progresses. No flashes, no floaters. However, in a few folks, they may see the floaters and flashes. When there is one of these symptoms, there's a slightly higher chance of a retinal tear. How does a retinal tear occur? As the jelly is liquefying and collapsing, this posterior hyaloid is moving away from the retina, and in rare cases, this membrane may tug a bit too hard and rip the retina. The problem with this tear is that this liquefied gel can then get into the tear and pull the retina away, causing a retinal detachment. A retinal detachment is a vision threatening and blinding process if not caught and treated. When we're examining you, we are looking exactly for this, either a retinal tear or a retinal tear that progressed to a retinal detachment. The process going from a retinal tear to a retinal detachment is usually a few days. We will be looking at you very thoroughly, leaning you back in the chair sometimes, perhaps even using an instrument looking at the very far parts of the eye to make sure we don't miss a retinal tear or detachment. This, however, remains a relatively rare event. Sometimes in the process of separation, a blood vessel may get tugged, which will then give a small spurt of blood into the vitreous and then seal itself and not produce a full tear. The blood will then be absorbed by the body in a few weeks. The process of a normal vitreous separation in eye lingo is called a PVD, posterior vitreous detachment. Once the eye settles down, there's no expected change in your prescription or anything. If we do find a retinal tear or a retinal detachment, we do have some very good treatments. Please do inform us if you have a family history of retinal tears or retinal detachments, as that sometimes can predispose you, as there can be a hereditary component. Most floaters eventually move out of your vision, moving downward and out of your central visual axis due to the pull of gravity as the jelly liquefies. Unfortunately, in some folks, the floaters can stay in the center of vision and be very annoying, especially if you're stressed. Over the decades, there have been many attempts to rid the eye of floaters, such as using lasers, injections, and surgeries, but no treatment has emerged as the gold standard. Nothing that has a full consensus of the retina community due to concerns of both efficacy and safety. Some people have persistent flashes, but these eventually resolve. You may notice that the flashes or the arc just occurs at nighttime in the dark. This is reassuring as this is the normal course of the vitreous separation. We ask that you be a bit hypervigilant for the next 4 to 6 weeks, with the first 3 weeks being the most important. If trouble such as a retinal tear or retinal detachment were to happen, it will likely happen in this time period. Sometimes, if we see you early in the vitreous separation or PVD process, we may ask you to return to clinic in a few weeks in case you develop a tear. We do this as a double check. However, if you should see more flashes or perhaps more dynamic increase in floaters or a darkening curtain in the side of your vision, or you just feel something just isn't right, please don't wait for that scheduled appointment. Please give our front desk a call. They are trained to listen to your verbal cues and will get you in for a checkup. The most important thing is that there is absolutely no need for panic. Our phones are open 24 hours a day, 7 days a week for this type of concern. If you don't have a retinal tear and you have had a true completion of your vitreous separation, your chance of a future retinal tear or retinal detachment in that eye goes down dramatically, as there shouldn't be anything left pulling on the retina. We don't have any hard and fast recommendations on activities to avoid during this time, but it may be a good idea to avoid activities for a few short weeks that could lead to a direct jerk to the head, such as, kickboxing or bungee jumping. But regular activities like running, swimming, weightlifting, flying on an airplane, bending over, all are just fine. If you get flashes in both eyes at the same time, or if you have flashes and you can't tell which eye is the problem, there's a low chance that this is a retinal issue. Just letting you know that sometimes this can be a manifestation of stress. What do we do if we find a retinal tear? The goal, of course, is to prevent a retinal detachment, which then would require an operating room surgery. To secure a retinal tear and to prevent it from progressing to a retinal detachment, The laser essentially is used to solder the tissue around the tear. We don't want liquid vitreous fluid from entering the tear and getting beneath the retina. The retinal laser procedure is as follows. We first put a numbing drop into your eye and then put a lens on your eye that prevents your eye from moving, and it magnifies the retina for me. Some retinal surgeons do this effectively without the lens in a slightly different technique. We then apply the laser spots around the tear. In most cases, you will feel something, but it tends not to be too painful and lets it sitting on top of a nerve. The procedure takes less than 15 minutes, and immediately after the laser, you will likely be black blind from the lights. Don't worry, as you'll recover your vision in the next few minutes. The laser spots start taking effect immediately, but full effect occurs after about 1 week. We tend to ask you to return for a follow-up in a few weeks. I'm confident that the laser scars will bloom and do the job, but what I'm more interested in is making sure that you have not developed any new holes or tears. Because this is laser surgery not causing any bleeding, there is no risk of infection. You can even put your contact lens back on without fear. Are there any risks involved? There is a very remote risk of having the laser hit the center of vision called the macula, and it can cause your reading and central vision to markedly be lost, but this is exceedingly rare as your retinal surgeon is very well trained and very well rehearsed in this common laser technique. You are likely at a greater risk by not having this procedure done. The laser does not affect the floaters in any way. They will take their own time to resolve and move away. In rare cases, the body can have a retinal tear, or even rarer cases of a retinal detachment where the retina healed itself. We usually find these in retrospect when we come upon a healed area. If we retina docs find a tear with symptoms of flashes and floaters, we don't chance natural healing. We apply prophylactic laser. Now, there are cases where upon routine examination, we might come upon a retinal hole or tear that wasn't present with symptoms, no flashes, no floaters. Because the chance of an asymptomatic or retinal tear, meaning not accompanied by a flash or float, progressing to a retinal detachment is pretty low, we may choose not to apply laser. Your retinal specialist will look at all the factors while making this determination. Are there certain factors that may predispose me to having threatening retinal detachments? I'll discuss the 4 main ones. Number 1 is the family history, as there might be an increased chance of retinal trouble. Yes, we are a bit more vigilant about nearsighted people. We call them high myopes, as the risk of retinal detachment is just a bit higher for these patients than the general population. Number 3, there's a small lifetime increase in retinal detachment risk in patients who've had cataract surgery. Number 4, we are a bit more hypervigilant in those with a finding called lattice degeneration. This is a thinning of the retina in the far parts of the retina that is present in about 10% of the population, and again, makes you just a bit more susceptible to a retinal detachment. Your eye doctor will let you know if you have this thinning. In some cases, the retina in this area can thin so much that it can cause a hole to form. If there are no symptoms of flashes and floaters, it doesn't tend to progress to a retinal detachment, so we don't prophylactically apply laser around most of these cases. Doc, I notice an area of darkness in my vision. This might be a sign that your retina has detached. At this point, we're talking about a surgical repair in the operating room. There are a few techniques that your surgeon will discuss with you thoroughly in hopes of restoring some of your vision and prevent it from worsening. Without treatment, this retinal detachment may lead to permanent, irretrievable blindness. Wow, this was a long discussion on retinal issues. In summary, we are delighted you are here, you listen to your body. If you have flashes and floaters, don't panic. You have time to give the eye doctor a call. If you need further evaluation and treatment, a retinal specialist will get involved. We have treatments for retinal tears and retinal detachments. In the rare case of flashes and floaters after laser treatment, it can signal the formation of potentially another tear. No reason to panic, but do pick up the phone to let us know. Just letting you know, after laser, it doesn't change the floaters in your eyes at all. It just addresses the tear. If there's blood in the eye, it will be absorbed in the next few weeks. If it's heavy floaters, hopefully they'll be pulled by gravity down below. Thank you so much for your attention to this matter. Your doctor will be in shortly for your examination and to answer your concerns. I'm Dr. Tanya Ghosh.